Congratulations on your new baby. There's no greater miracle in this world than parenting a baby. Now, don't you wish this precious infant came with instructions? I'm Dr. Jason Kessler, board-certified pediatrician, medical quality expert, and a parent. Let me guide you through some common issues in caring for newborns. First of all, I want you to know that you won't spoil your baby in their first 6 months. Hold and cuddle your baby as much as you want. Know that your baby will cry, and sometimes you won't know why. That can be really frustrating. When you find yourself getting stressed and frustrated, it's okay to put the baby down in a safe place for a couple of minutes while you take some deep breaths. That may also be a good time to tag team with your partner if they're available. I'm sure you've heard this, but it is my duty to remind you to never, ever shake a baby for any reason. I have another video that will give you special tips for a fussy or colicky baby. Anytime you put the baby down on any elevated surface, like a changing table, any piece of furniture, even the exam table at the doctor's office, it's important to be between the baby and the edge, and keep a hand on the baby so we don't pick a bad time to start wiggling and rolling and risk falling and hurting yourself. Babies should always be laid down to sleep on their back, in their own space, such as a crib or bassinet. They don't need pillows, blankets, toys, or even crib bumpers. All of these things can potentially cause breathing problems for the baby. Make sure the baby is wearing clothing appropriate to the temperature, not too hot. Always lay baby down to sleep on his back to decrease risk of breathing problems, including sudden infant death syndrome. Somewhere close to 6 months old, some babies will choose to roll over on their tummies to sleep. When your baby can do this all by herself, it's okay to let her sleep on her tummy, but always lay her down to sleep on her back. If anyone in your home or close to your baby smokes, the best advice I can give for that person's health and everyone around them is to quit. Never smoke around the baby. Homes are made to be well ventilated, so smoking anywhere inside will let that smoky air get around in the house. Better yet to always take it outside, but that smoke will stick to clothes and hair. You hold that baby nice and close to you so she can breathe it in from just that. You should change clothes, take a shower, and wash your hair before holding the baby. If that isn't possible, I at least recommend smokers to have a particular smoking jacket or shirt that you always wear when you're smoking and remove that when you're done. Breast milk is by far the best and perfect food for baby. Some breast milk is better than none, and if you can't fully breastfeed your baby, formula is fine. If you think there's a problem with your formula, it's best not to change formula without talking to a healthcare professional first. Your baby should be getting all the fluid and all the nutrition she needs from that milk or formula. We don't recommend giving babies any plain water until they're a year old, and we don't recommend starting any solid foods until about 6 months old. It used to be that we recommended this a little earlier, so resist the temptation if grandparents or other well-meaning friends or family tell you to start earlier. You can tell them Dr. Jason said to wait if you want. Honey also should be avoided during the first full year of life. Honey can have some bacteria spores in it that can make babies sick. It doesn't cause any problems in older kids or grown-ups, but that's the reason that we steer you away from using honey during that first whole year. So don't sweeten a pacifier with honey or otherwise give any honey to your baby. Jaundice is a yellowish discoloration of the skin or white part of the eyes, and it's very common in the first week or so of life. The problem is that if babies get very jaundiced, that yellowish pigment called bilirubin can build up in the brain and other tissues. It's relatively easy to check the blood for this bilirubin, so check with your baby's healthcare provider if you see jaundice getting worse. The treatment is usually ultraviolet lights, which break up the bilirubin. At home, you can let the baby get a little sunlight to help by holding the baby by a sunny window or taking a short walk in sunny weather. But babies shouldn't be exposed to direct sunlight, so keep them shaded, or only for a brief time should they get any actual sun. Some constipation is pretty common and usually does not need any specific treatment. Be sure you're mixing your formula correctly if you're using formula, and ask your baby's healthcare provider if you have questions. Breast milk is the perfect food for your baby, and it is so efficiently digested by the body that sometimes healthy breastfed babies may go for days without having a bowel movement, and that can be completely normal. The umbilical cord usually falls off at about a week old, but it can stay on for a few weeks without problems. Sometimes when it does come off, there's a little blood and some gooey drainage, Sometimes that drainage does not smell very nice, and that's normal. Occasionally, the cord doesn't come off all at once. Usually, you don't need to do anything but keep the area clean with nothing more than soap and water. If the skin or the belly button itself are red or seem swollen, ask your baby's healthcare professional to take a look at it. At the 2-month checkup is when most babies get their first full set of immunizations. In most areas, there are 2 or 3 shots and a little drink that the baby will get all at once. After getting vaccines, it's normal for a baby to get a little low-grade fever. But up until that time, babies should not have a fever. If your baby has a temperature of more than 100.5 degrees, 100.5 degrees by any method of temperature taking, bring your baby in to be checked right away. An infection can spread through a small baby's body quickly, so we should find out the cause of a fever right away. Congratulations again on your new bundle of joy. Parenthood can be hard, but with a little humor and a lot of love, you'll get through it. If you have any questions about your baby, please ask your baby's healthcare provider. If there are specific topics you'd like to see me cover in future videos, please let me know. I'm Dr. Jason, at your service.